So, Amy, how bad is the crisis situation? How many people are you seeing with mental health issues and the support that would be needed at this center?
We really have had an influx. We've always been a busy department, but I would say since the onset of COVID-19, it wasn't as bad until the quote unquote got back to normal, and then that's where the influx has happened. And I can't give you exact numbers, but there are days where we're responding to 5 to 7 calls just on day shift alone, and we have a 24-hour, 365-day program, and it's definitely, yesterday I know we responded to 5 different calls, and this is from the hospitals to the jails to the schools to people's homes, and they're always presenting a lot of times in the emergency room department, and our goal with this new mobile crisis response team is to meet them where they're at, whether it be in the home or in the hospital or in the jail, but trying to divert people to not go to the emergency room, because in that moment, unless they're going to a hospital, they don't need medical clearance. If they just need some extra support and care, that's what this crisis stabilization unit's going to do. It's going to be a 1 to 3 day stay for what's appropriate, and you're going to have an engagement specialist with the lived experience, and you're going to have a crisis counselor there to help wrap around and help them get stabilized without going to the emergency room department.
Okay. Charles Kelly with the MedStar said that usually 9 calls a day are for mental health support. That's not counting the medical issues that they handle. One of the biggest issues that keeps coming up is that the people that are in crisis or that would be using this unit are going to be violent. Can you speak just a minute to your experience with violence and your teams going in to help people? Is that really a concern for you?
Nope, I've been doing this since 2012, and I think I had 2 concerns my whole career since this. Most of the time, people are coming to us because they want help. So people who want help are not normally violent. If they there are different reasons they may become violent, with the drug use or whatever. Maybe they are psychotic, but even with that, them are very rare. There's 3 different ways we either involuntary admit somebody, voluntary because they want to go, or it's a safety deflection plan. And we do more safety deflection plans and try to keep people in their safe environment, because it's all about the least restrictive than it is. I would say we might have 5 involuntary admissions a year. Give or take a few, but overall, even in all the invols, I can remember 2 that were kind of scary and violent.
Okay. So the ERs are really being bogged down with the clients who need a bed somewhere but can't get there. So they're basically sitting in the ERs not being treated, waiting for a bed somewhere. What's your experience with that? How often do you have clients sitting in the ERs, which would potentially keep an ambulance with an accident or a heart attack person from being seen? How bad is that?
It's very bad. The weekends are worst. MedStar, unless it's local, they'll only go to 2 hospitals on the weekend because they cannot afford to have a 911 truck out that long. So if I can't get a bed at them 2 places, then they sit all weekend long. And on average, they sit from between 16 and 24 hours just waiting, because we don't have a lot of psych facilities either that are even appropriate.
So in your opinion, is there a need for a behavioral health treatment center for crisis stabilization in Randolph County?
Absolutely. We need it more than what people know, and it's one of them things people don't really know what goes on because they don't have to. We are in a small little sleepy sweet town, but there's a lot of things that go on behind the scenes, and that's why we are asking people to partner with us, because it's not our job. When we think of mental health, we juicy stories, they sell. So you want to hear the worst of the worst, or my experience and what I've seen, but the day-to-day are just people who are broken, who need someone to help support them and put them back together. And they're usually very kind and thankful and very appreciative. That's why the engagement specialist piece is so powerful, because they are people who have overcome and walked that, and now they are willing to give back.